Commissioner, is the Milwaukee City Health Laboratory doing any of the testing, or is the State Lab of Hygiene processing all of it?
Well, right now, and certainly our lab is working very closely with the State Lab of Hygiene in Madison, and all samples are currently going there. We do have capacity here, and if this pandemic would unfold as many think it would over the next several weeks, then we have some redundancy in capacity. Our lab is capable, but right now everything is centralized in Madison. We do anticipate that we may get the call to do some of the initial analyses. The confirmation of this spread of swine flu is happening at the CDC level. The state lab in Madison is the central repository for all samples. But our lab is at the ready, and we're positioning ourselves, and we have a daily conversation with the state lab on hygiene.
Are you aware of anyone in the city of Milwaukee that is under heavy suspicion right now as a possible case?
Well, one of the things that we're doing in terms of surveillance and case management is that we're looking at disease trends, and that's a lot of shoe level work. That's having our epidemiologists and their staff actually going out and tracking down every single lead that they believe that could be someone who's been impacted. As you know, flu circulates in our community all the time. So we have to look at the case definition and to rule that out. We, at this time in Milwaukee, have no suspected case. However, we're weeding out all of the information that we're getting, and we're ruling out daily cases of regular influenza that may be circulating in our community. And that's a tedious task for our team. But this is what our epidemiologists do daily.
Considering how infectious the disease is, are you recommending that people who think they might have it to avoid emergency rooms or take precautions before going to the doctor's office?
Well, certainly one of the things we want them to do is to call their provider before going. What it will allow for is for that provider and other providers to position themselves and to prepare that waiting room, to prepare that doctor's office so that they can have universal precautions. Because if one thinks that they meet the criteria that we talked about, and they feel that they've come in contact with someone who's sick, we would hope that they would call the provider. We know that won't always happen, but to minimize spread of disease, it's important that you contact that provider and say, I believe that I have been in contact, or I believe I have the symptoms, I want to come and see you. That will allow for that medical facility to take the appropriate action to keep the healthcare workers safe, but also others who are in those waiting rooms. That's going to be key.
Availability and effectiveness of the vaccine?
Well, right now, there is no vaccine. Certainly, at the federal level, as you all know, 25% of the national stockpile for antiviral medications have been released and will be coming to states, including Wisconsin. But certainly, there's been a lot of discussion about vaccine production. And I'm sure that at our national Center for Disease Control and other agencies, that they're looking into vaccine production. That is for the future. Right now, prevention is our key, because the vaccine, even if one was identified, would be a minimum of 12 weeks before you could see the first vaccine come off the shelf for any type of trial. So vaccine is not an option at this time.
Are you doing more to respond to this than you did for the avian flu a few years ago, and why does this seem like the response is greater?
Well, the avian influenza gave us a wake-up call. And one of the things that we did in response to that in 2005 was to produce a plan, because we believe that a pandemic is inevitable. Why is this requiring a greater response? Because it's here. Because we have sentinel cases, because there are 40 cases in the United States. Whether it is a source from avian influenza or swine influenza, at this time, the same precautions that one would take during that perceived outbreak in Asia is what we have to do here in America. What complicates this matter is that we're seeing something in this novel virus that we've not seen before, and we recognize that we have to be very, very prudent in getting out in front of it.
Anopheles effectiveness?
I'm going to defer to our Chief Medical Officer on the effectiveness, Dr. Swine, on antiviral medication. Certainly it's a part of our arsenal, but I'll have Dr. Swine address that.
There's Josh Swine, the Medical Director of the Health Department. There are several categories of antiviral medications. and two main categories. And one of those categories is not effective against this strain, but the other is. So there are antiviral medications available to treat this. Not every antiviral will work against it, but there are effective antivirals, and they are being recommended for use in people that have suspected swine.
Does the city have a stockpile similar to what the state is talking about today of medications?
Well, what we have is a plan to plug into the national stockpile, and we have coordination with the state on that. Certainly, we haven't gotten guidance on how that distribution would be, and currently, as you know, the national stockpile was just released during the declaration just a few days ago. So we don't have a stockpile at hand, nor does anyone else for that matter. It's all being delivered at this time. We will work with the state of Wisconsin to determine that. It's one of those things that, again, is evolving. States that have been impacted with cases on the ground are going to have first priority to that national stockpile. Certainly we know that some of the antivirals that are mentioned as a part of the stockpile are out there, and there's some access to them, but at the volume and level that might be needed to deal with those who could be impacted, the city and every other city in the country is waiting for that national stockpile to be disseminated.
Commissioner, when you talk about canceling big events or preventing big groups of people from getting together to prevent the spread, what kind of events are you talking about, and how serious would the outbreak have to get before you would talk about canceling an event at the Bradley Center or some festival or something like that?
Well, our key goal here is to protect the public health and to minimize potential spread of disease. This morning I consulted with my team, and I also consulted with the city attorney on the quarantine and isolation powers to make certain they are ready to go and that we can exercise those at the right time. We recognize that once clusters of disease show up in our community, that large venues may be the perfect place for a mixture of people, time, and viruses that are circulating. We will look at schools. We will look at concert halls. We will look at public gatherings where there is a high probability of transmission. Our pandemic influenza plan has staging, and we're at the very early stages of our response. And as we see this disease unfold in our community, we will take those quarantine and isolation powers and push them forward. We're going to take that seriously, but then again, I think, it's the public's help that's going to allow our plan and our response to be good for the city of Milwaukee. So we will look at that. We will utilize our public health statutes to protect public. But we may have to invoke that sooner than later if cases show up in Wisconsin and we believe that disease is spreading quicker than we can respond.
Can you estimate, would 100 cases in the city of Milwaukee trigger that sort of threshold, or would 1,000 cases?
I'll have Paul Biedrowski come up and speak to that. He's division head responsible for the details of that plan. We have thresholds. I'll have him speak to that.
Thank you, Paul Biedrowski, Director of Disease Control and Environmental Health. So as the Commissioner mentioned, one of the interventions would be the distribution and dispensing of antivirals. The Strategic National Stockpile is a federal asset that is on its way to many states, the priorities being those that have identified cases, the 5 states. The guidance that would flow from the state would come to local, larger areas like Milwaukee. It would be strictly up to the locals to decide how that dispensing would occur. Our current pandemic plan dictates that first responders, healthcare personnel, and those cases and contacts at high risk of disease or exposure would be prioritized. But again, that's per the current pan-flu plan. We rely heavily on conversation and guidance with the State Division of Public Health upon receipt of that asset. So we have no idea at this time how much that would include or what that guidance would look like. But certainly we're preparing for receipt possibly in the future.
What's considered a high risk, right?